Good morning. My name is Fran. I'm a Bellarmine University nursing student, and I'm going to be helping you this morning. But first, I need to make sure that I have a correct patient. Can you please tell me your name and your date of birth, please? That is Mr. Lewis Lutz, and your birth date is 12/23/49. Great. Well, what we're going to be doing today, Mr. Lutz, is we're going to be changing your sterile dressing on your wound. And it should take probably about 10 minutes or less. Are you having any problems with your wound at this time? Okay, good. Well, I'm raising your bed so it is a comfortable working height for me. And then I'm going to lower the rails. Okay, I'm going to go ahead and put on a pair of gloves. So that we can take the dressing off that is currently on there. And also at that time, I'm going to assess your wound to make sure that there's no drainage or that the wound is in a good healing condition. So I can document that on my chart. Okay. Alright, so let's go ahead. I'm going to expose your wound. We're going to go ahead and take that dressing off. All right. Very good. And as I said, we are going to assess the wound at this time to gauge where it is in the healing process and to make sure that there is no drainage. I'm going to also remove the dressing. Okay. Alright, so at this time, I'm going to go ahead and prepare my supplies for the sterile dressing change.
We have Lopicagol, the 75 milligram oral tablet. In once daily at 8 a.m. So it's 52. We're still within the time frame. It is intact and the expiration date is still good and it is not been given previously. We'll replace that.
I'm going to lift the bottle.
Now we can begin prepping our other medications.
Or just enough to moisten the dressing.
We have cyanocobalamin. It's vitamin B12. The dose we'll be giving is 1 milliliter. The concentration for this is 1 milligram per milliliter.
Sure.
It is to give intramuscularly in the right vastus lateralis muscle. It is to be given
Cap the bottle to the side. Practice hand hygiene. And at this time, I'm going to apply my sterile gloves.
So we can begin prepping that.
Without turning my back to the sterile field and making sure that my patient cannot roll out of the bed.
So I've chosen a 25 gauge by 5 inch needle. And our patient is 52 kilograms. And we give him in the right vastus lateralis. And we have a 3 milliliter strength. The dose is 1 milliliter, so we'll draw back 1 milliliter. And input it. And draw back 1 milliliter.
And now we're ready to begin dressing the wound. Take one of our sure we squeeze out all the excess liquid. Open up the gauze.
Now this one, I've prepared a label with the patient's name, the name of the medication, the dose, the route, and the correct time. We will put this on the cap for syringe. We can set
I
that
completely
aside.
open up the gauze.
We will now.
That will help us to increase the surface area.
So we have regular human insulin, 100 units per milliliter injectable solution, given subcutaneously every day before meals.
Fluff.
If it has not been given before. Her last blood glucose reading.
And we're ready to pack the wound. I want to make sure that we are not
Based on the Lotus sliding scale, we will be getting 15
going to
units.
touch the outside of the wound. We're going to lightly pack this inside the wound. And if we need to, we can use
We'll be using the universal insulin syringe identified by the orange cap.
and we're just lightly packing. We don't want to pack it too, we don't want a hard pack, we just want a light pack.
15 units of air.
Okay. We're going to take the second gauze dressing, squeeze out our excess liquid, and repeat. Open it up. Completely unfold the dressing.
Now, for insulin, I will have a fellow nursing student check, make sure I have the right amount.
Alright, so
So
we
this for
completely
Mary
open this up.
Her last blood glucose reading was
Also going to fluff it.
263. So,
I see regular insulin at 15 units.
We are also going to pack this one in lightly.
right, now.
Without,
before
as I said before,
entering the
without
patient's
touching the
room, we will
the
do
outside
a
of the
second
wound.
check with the HR. So I will recheck the label on the bag I took
Okay.
medicine from.
Lightly pack it.
Meredith Lewis, 801, 1933, 801, 1933. MR number 0987.
And then we're going to apply
So I have the correct.
ABD dressing.
And we'll start with oral tablet, Clopidogrel, 75 milligram oral tablet, to be given by mouth.
We are reusing our ABD because of a shortage of supplies, but in a clinical setting, this would still be sterile. Put that over, place that over the wound. We're going to tape it to our patient's skin.
We also have
Once the wound has been covered,
cyanocobalamin,
we don't need to worry about the sterility of our field. Okay. All right. Mr. Lutz, we have successfully changed your wound dressing.
1 milliliter MR dose.
Clean up my supplies.
Given now for Meredith.
I'm going to lower and lock your bed.
Medication we have for Meredith.
Place your call light within range. Okay. If there's anything that you need, please don't hesitate. Come around. And don't hesitate to use the call button right here if you need anything at all.
Subcutaneously. Her last blood glucose reading was 263, so we are giving 15 units for the Lotus sliding scale.
I appreciate you allowing me to work with you today. And if you need, as I said, one last time, if there's anything else that you need,
Not been given before.
feel free to give us a call.
So now we
Thank you very much.
patient's room and do our third check at the